meeting here for such a nice webinar. Actually, it's a much beyond the conventional academy. It's a questions that would be discussed and would be elaborated, which will be pertinent probably in the future, or everybody, a new pediatrician who is starting practice, as well as those who are in practice for 8 to 10 years now, thinking something else. And it's not related to conventional academy. And to discuss these things, we are very much fortunate to have none other than our Samir Hassan Dalwai, who is the moderator here. And we have got equally capable and eminent panelists, which will be introduced by our chairperson. We are very much fortunate to have them. So I'll introduce the chairpersons. Before that, I'll really ask Arubda. I'll really ask Arubda to say a few words. Arubda, please. Unmute yourself. Unmute yourself. Arubda, please unmute yourself. Yeah.
Thank you, Kipa, for the nice our e-libraries program, which is going for the last 1 month. It is a very, very important. And today's topic is also very important, where the many learned faculties, which will be moderated by our beloved Shamit, Pawan will be there, and all other Dr. Reddy, Dr. Khurshid Ahmedwani will be, Mandira will be there, Mrityunjay will be there. It is a very much happy learning program of the WAP under the leadership of our present President, Scientific Chairperson, Otonu Kipa, and everybody are doing very, very good for the happy learning of our participants and the WAP members. Thank you, everybody.
Thank you, Arubda, for your kind words. May I request, we are very much fortunate here. Kalpanadi has just joined in, our president of West Bengal Academy of Pediatrics. May I request her to say a few words. Kalpanadi, please.
Yeah, first of all, I'll really, please excuse me, and I'm really extremely sorry in joining late because I was having another important meeting and my video is disturbing, so I cannot open my video also. Some problem is there. But I must say that good evening to everyone, all the faculties, and there's lots of August faculty I can see in the video, and I really welcome you all from core of my heart on this webinar. And this is a very interesting webinar, jo jara hatke hai. It's not a subspecialty or any particular chapters webinar. It's something unique and very different. We are really eagerly waiting to listen from all the August faculties and what inference will be drawn from this webinar. I'm very eagerly waiting for that. And without much wasting much time, I must welcome all of you, and I welcome all the attendees and the others who are there here. And I thank you for giving me the opportunity to speak on. And now I will hand over the platform to either Dr. Kripa Sindhu or Dr. Shopan Roy.
As thank you. You have really picked up the string very nicely, and cannot be more thankful than to Samir Hassan Dalwai, who has put such an unique topic, which is not discussed anytime.
Yeah, we are eagerly waiting to listen from Dr. Samir.
And Swapanda, would you like to speak few words? Just one or two.
It's a warm welcome to West Bengal Academy of Pediatrics e-series, e-library series. And the stalwarts like the Samir Hassan Dalwai, Dr. E.K. Tiwari, Dr. Mrityunjay Das, Dr. Pawan Kullans, Dr. Osini Agarwal, Dr. Reddy, Dr. Khurshid and Mandira is there. So I think we must start the program right now.
Okay. So without wasting time, we have very much fortunate to have our chairpersons. This is a nice program. Another facet of this program is that this program is represented from north to south, from Kashmir right to the bottom of India. So this is really a pan-India program. So, and it is our able chairperson, sir, Dr. Mrityunjay Das, who is a professor of pediatrics of KIMS Hospital, Sam Hospital and KIMS Medical College. And Dr. Anil Kumar Tiwari, who is associate professor of Patna Medical College, has got many facets. It's if I go on discussing their facets, it will take another webinar. So without wasting time, may I request Dr. Mrityunjay Das to initiate the proceedings. Unmute, please. Sir, unmute, yeah.
So very good evening to one and all. And I am really happy that I already have told Dr. Kripa Sindhu about the attending the marriage ceremony.
Yes,
But
yes.
still, I am very interested for this topic. This is a very new concept. Hopefully, it will go smooth after this discussion of this learned panelists. So, without any much delay, I want to introduce our panelist of the today's panelists. So, it will be the coordinator will be Atanuda, and our most important part is the moderator, sir, Samir Hassan Dalwai, sir. So, long CV for Samir Hassan Dalwai. I know that everybody knows Dr. Samir Hassan Dalwai in this panelist as well as in the viewers link. So, should I go for Samir Hassan Dalwai CV, sir?
No, not needed. Not needed. Not needed.
Not needed.
Mrityunjay sir, you do that, and panelists will be
let us
introduced
welcome
by
all the
Dr.
panelists.
Tiwari.
Dr. Pavan Kalyan, Dr. Ashwini Agarwal, Dr. K. Ubula Reddy, Dr. Khurshid. Dr. Khurshid, I met him in Kashmir recently, and Dr. Mandira Rai. So all panelists are here. So I request our Anil sir to introduce with a short CV of each panelist. Dr. Pavan, Dr. Ashwini, and Dr. Ubula, Dr. Khurshid, and Dr. Mandira.
Right.
Sir, very quickly with a short CV, sir. Quickly, we'll go for
Okay. Thank you, Mrityunjay sir. Thank you. So good evening, everybody. I am thankful to West Bengal Academy of Pediatrics for inviting me to chair such an important session. The moderator is Dr. Samir Dalwai, present treasurer of CIAP. He is well known to me for more than a decade, as we have worked together in the neurodevelopment chapter. He is a brilliant speaker, and I always love to hear him and learn a lot regarding ADHD, autism, and other neurodevelopmental disorder. So really, such a nice presenter I have ever seen.
Thank you,
In
sir.
present scenarios, super specialty is the need of everywhere and every person, and to develop a subspecialty in our practice is a similar approach. I hope I am going to learn a new subject, and this will be definitely going to boost our clinical practice in private way and in government hospitals also. So discuss this subject, we have eminent panelists, Dr. Pawan Kalyan. Dr. Pawan sir is MD and FSCI Fellowship in Pediatric Pulmonology and Sleep Medicine from Australia. Professor, Secretary of IAPP State, Treasurer IAP Medical Education Chapter, Joint National Coordinator, National Joint Scientific Member, DIAP Academic Committee, and Consultant Pulmonary Allergy Sleep Specialist, and other things. The other
Winning.
panelist is Dr. K. Abula Reddy, sir. Sir has done DNB in 1998 and postgraduate program in pediatric nutrition chapter in 2016 from Boston University. He is life member of IAP since 23 years, director and consultant pediatrician, Little Heart Children Hospital, and he has received many awards like to mention few, National IMA President for Outstanding Service as IMA Secretary Kadapa in 2014 and for ongoing Andhra Pedicon in 2019. Sir has contributed in many fields of IAP. He was Joint Secretary, Organizing Secretary, Secretary IMA, Secretary IAP Kannada branch, and so many posts Sir has hold. Another panelist is Dr. Ashwini Agarwal, sir. Dr. Ashwini Agarwal, sir, is MBBS GCH, Child Specialist, Nutrition National Equity Board member from IAP, State President, CGAP, Vice Chairman Person, FBS IAP, Chairman, Committee Pediatrics of IAP, Treasurer, National Neurology Chapter, Secretary. GSIP. Another learned panelist is Dr. Khurshid Ahmad Wani.
Dr. Anil sir, I am telling about Dr. Kursid.
No, just I have सब मोबाइल में है सर, इसीलिए दिक्कत है. I do not get time to print this. Dr. Khurshid Ahmad Wani is a professor, Department of Pediatrics, Government Medical College, Srinagar. He done his MD, DNB, PGDD, and fellowship in pediatric neurology. Executive board member, AOPN, executive board member, IAP 23, vice president, AOPN 23, IGNU examiner, PG guide, fellowship pediatric neurology guide, pediatric publication in various national international journal, and he has few chapters in few books. Our last learned panelist is Dr. Mandira Rai. Dr. Mandira Rai, DNB Pediatrics, PGDDN, CDC Kerala. Sir, Madam, when do you did this degree? Mandira,
Sir, I completed in 2022. Our batch was COVID batch. So we started in
2022.
2000.
So
We started in 2019 and finished in
I came to
2023.
learn that this degree has been now not being held there. I have, and Dr. Samir has also got his degree from Kerala.
Okay.
Madam
So
Mandira
they
Rai,
are running after a long gap. They are running the course
you-
again.
okay. I was there in 2008-9.
Okay, sir.
Okay. Assistant Professor, Santiniketan Medical College, West Bengal, Consultant Development Pediatrician, Reborn Child Development Center. So now I hand over the mic to Atanu sir to
Thank you.
for further proceeding.
Okay,
Atanu sir.
thank you. Mrityunjay, you want to add anything for
Yes,
Khurshid?
yes, I want to tell that some of the audience from my college, they want to know about Samir Hassan Dalwai sir. So just few lines. Dr. Samir Hassan Dalwai is developmental behavioral pediatrician who has dedicated his career to deliver contemporary intervention to children with special needs and their families. And he is the recipient of the prestigious government India's Rajiv Gandhi Manas Seva Award in 2012. And he is the founder, director, and consultant at the New Horizons Child Development Center, Mumbai. And he and his team has proposed the social interaction theory of autism as well as the social communication sequence of development. His current work is around delivering online intervention program for children with special needs. And everybody knows that he is now the current national treasurer of Indian Academy of Pediatrics Central IAP. And he is the past chairperson of the IAP chapter of the Neurodevelopmental Pediatrics and past president of IAP Mumbai. And he is the editor-in-chief of the IAP Handbook of Developmental Behavioral Pediatrics. This is for the audience who are in the audience list. Because few of them
Thank you.
requested that to tell about Samir sir. They do not know somebody in our college.
Okay.
Very few young people.
Let's
Thank you,
start the
Mrityunjay.
session. Everyone loves Dr. Samir.
That
So
our
welcome.
PG student, our
Yeah,
PG student.
Brilliant.
Welcome,
speaker,
Dr.
brilliant
Ashini,
speaker.
sir.
Dr. Ashini Agarwal just joined in. I
Yes,
welcome
just
him.
joined in. Sir, you are, sir,
Dr. Agarwal.
yeah,
Yeah,
Ashini,
good
sir, you
evening,
are okay now?
everybody. Thank you.
Sir. So we are very
Good
anxious.
evening, sir. Good evening, sir.
Yeah,
Good
we are
evening.
very anxious with your news and that hopefully everything
I
is
asked him, sir, what told, yes, I'm in OPD now.
Sir, let's start. So, Dr. Samir, sir, I think we have a round of introductions, but finally it boils down that whether we can, what will be the way where this practice can be built up in some other way that we can have a part of subspecialty in our chamber. How important it is and how do you think it's very essential or to get an idea of subspecialty included in our normal office practice. So not to speak of the tertiary care, just of the office practice where most of our members belong. So whether that is very essential. So over to Samir and your panelists, please.
Respected President, Dr. Kalpana ji,
respected members of West Bengal Academy of Pediatrics, beginning with our dear elder brother to all of us, Dr. Rupda. Then again from the WIP, Dr. Dibendra, Dr. Samik Hajra, respected chair, and Dr. Sameer Ranjan Das, respected chairpersons, my dear respected Tiwari Saab, respected Dr. Mrutyunjoy Bhai, and my dear Dr. Atanuda, Dr. Kripa Sindhuji, and as well as I am blessed to have a wonderful panel along with Dr. Swapan Kumar Ray sir, who is going to be guiding us, and the panel comprising experts from various different fields. Dr. Ashwini Agarwal ji, welcome sir. Dr. Kubul Reddy ji, welcome to you. Dr. Pawan Kalyan, I am so happy you could make it today in spite of all the problems. Dr. Khurshid Bhai Wani, whom I just spent a wonderful weekend in Kashmir with some time back, as well as Dr. Mandira, who is my colleague and a wonderful budding developmental pediatrician, and everybody else who has joined in, the delegates from all across the country. Namaskar and good evening to all of you. When this discussion came up that we should have a panel discussion on a topic which is important to everybody, I am happy to tell you that we are not going to talk about autism today, because I think everybody is fed up about listening to me and all of us talking about developmental pediatrics. तो अभी किसी डेवलपमेंटल पीडियाट्रिक्स के बारे में नहीं करेंगे बात, मगर पीडियाट्रिशियन के डेवलपमेंट के बारे में बात करेंगे. और the reason for that issue is such that some of us I am basically I always started off as a general pediatrician. For 5-6 years I did general pediatrics. Then I developed interest in a specialty called developmental behavioral pediatrics. But there is no financial way that one can do that. You can't give up your basic practice. And when I say this, I'm sure all of you can identify with this, because ये सबकी कहानी है. Today we are not going to talk about a purely academic point, but we are going to discuss about an issue which affects everybody's academics. So I could not give up general pediatrics. I continued to do general pediatrics in the clinic. I was attached to 1 or 2 nursing homes, running for night calls, and then gradually started doing developmental pediatrics. Gradually kept increasing the practice from 1 center to 5 centers. And over 10-12 years, then when I had enough practice in developmental pediatrics, I stopped doing general pediatrics. But till that time, I was doing general pediatrics as a profession, and I was doing developmental pediatrics actually honorarily. I was not charging for the services. But once I realized that now I feel I have enough knowledge that I can be a professional, I switched over to that. And now for the last 8-10 years, I don't do any general pediatrics at all. But today, I am convincing and trying to convince my friends like Atanuda to try and do part-time developmental pediatrics, because the need for that specialty is great. Similarly, the need for pediatric cardiology, pediatric nephrology, pediatric gastroenterology, it's so difficult to find somebody for a gastroenterology or a hepatology problem, is so much that Indian Academy of Pediatrics has now so many chapters and subgroups that work on separate specialties. And all of us here on this group and all of the delegates are members of if not 3 or 4, at least 1 or 2 chapters in our practice. I know dear Pawan, who is a very good generalist, but is excellent at allergy, is excellent at sleep apnea. Mandira now is trying to balance both. Khurshid Bhai is wonderful at general pediatrics, runs a 500-bedded hospital in Srinagar, but also is keenly interested in neurology. And my 2 dear brothers, Dr. Agarwal sir, Ashwini ji, who is an expert at medico-legal, is expert at constitution, whether it is Indian constitution or IIP constitution, as well as Dr. Kannala Obula Reddy, who is such a very busy general pediatric practitioner with a huge hospital and practice in Telangana. So the issue that we are going to discuss today is going to be touching the hearts of everybody as what we do when we are faced with this issue of increasing knowledge that we are expected to have. So I'll just allow me to share my screen. And hence the topic, dear friends, is developing a subspecialty within your pediatric practice. आप extremely successful pediatrician हैं. Either you are attached to a government hospital, you are either a lecturer or a AP or a professor or a reader, or you are in full-time private practice, you have a very busy, thriving pediatric practice, or you may be attached to a corporate hospital. मगर कहीं ना कहीं दिल मांगे मोर, you also are interested in nephrology, you are also interested maybe in neurology, you may be interested in gastroenterology. You know that you can develop that. But then there are very important questions. Can you give up your pediatric practice, go and do fellowship? If not, can you get some specialty training? But even if you get specialty training, should you stick to general pediatrics or should you do that subspecialty? Will other pediatricians refer patients to you? How do you go about this is what we are going to discuss. Developing a subspecialty within your pediatric practice. मैं समझता हूँ सबके दिल के अंदर छुपी हुई बात आज हम बाहर निकालेंगे. The issue is that all parents demand that each pediatrician must have specialized knowledge today. You are expected to be the expert and provide the detailed answers for everything, whether it is malignancy or epilepsy, congenital cardiac problems, autism, or even to tell the parent how to select the right school for my child. So basically, in a very competitive practice where there are so many pediatricians around the area that you are practicing, where parents' demands are increasing more and more, the pediatrician is expected to be a generalist also, a pediatric neurologist also, and a pediatric nephrologist, and a developmental pediatrician, and an oncologist. अब ये कैसे होगा? In addition to that, he's also expected to be up to date with all the medical legal practice because there are so many issues that doctors are facing, as well as IT rules, because now we have a hybrid or an online practice. So what are the rules? So there is so much of a mind-boggling agenda that today we are going to discuss that should practicing pediatricians develop interest in one or two subspecialties, and if they have that interest, should they practice a subspecialty along with general practice in their clinic, or move gradually away from general practice towards subspecialty as some of us have done, or continue to practice general pediatrics, but enhance their practice by collaborating with subspecialties so that patient of theirs gets even the subspecialty opinion or advice sitting in their own basic clinic. So my first question to our dear respected Dr. Ashwani Agarwal ji is that itne saalon ke baad you have taken so much mehnat, mashakkat, effort you have taken up, and you have set up a successful pediatric practice. Now, at this stage of your practice, do you feel there is a room for adding a subspecialty qualification? We'd like to know from dear Dr. Agarwal as well as Dr. Ubula Reddy, both of whom are extremely busy, very, very popular pediatricians. Sir, Ashwani ji.
Sir, good evening, everybody. I am thankful to West Bengal IAP and Central IAP for incorporating me in this very interesting topic. I am a general pediatrician and practicing pediatrician. Before that, I have served the government job for 2.5 years as a assistant surgeon at the tribal area, and we have to deal with all the from age 0 to adult and geriatric patient also. After that, in last 30 years, I am practicing as a consultant pediatrician at Raipur. My field is only on the as a general pediatrician, but I have some interest in my community pediatrics and vaccinology. So, to best of my knowledge, I can have some interest, but at the present time, I cannot change my profession to from a general pediatrician to a subspecialty specialist in my OPD. But I can guide the patient to some extent as per my knowledge and my experience. Tell me that that much help I can do for the patient. But at present time, for like my age of 62, it is not possible to shift to the subspecialty chapter and start a new OPD or new setup. As far as my personal opinion is that. Over to Dr. Reddy for his comments.
Thank you so much, sir. Dr. Reddy, sir, what would you say?
Sir, good evening, everyone, sir.
Good evening,
I thank greatly for West Bengal Academy of Pediatrics, our respected chairpersons, coordinator, our moderator, and fellow panelists. So thank you for the opportunity to be a part of this panel discussion under our great moderator, Dr. Samir Dalwai, sir, who has selected a unique topic to sensitize the present all pediatricians to go for subspecialty qualifications and updates, which is very important in our day-to-day life. So after setting up of so many since years, 25 years of into the private practice, now as on today, I feel there is a depth of requirement as well as the opportunity to become a subspecialist in various fields of pediatrics. And it is a great initiative has been taken by our even IAP Academy. Not all the postgraduates or the wishers cannot bag the DM seats. Now they at least they can become the fellows and excuse me, and fellows and become the specialists. So regarding the pertinent discussion, now after 25 years of into the general practice, to become a subspecialist, I think I have to do a fellowship or right entrance again go for DM, which is very quite difficult. But I can definitely make use of our IAP, so many modules, so many workshops, so many things, update ourselves and spend some more time and get more knowledge, and with the backup of some technicians or some other young pediatricians, definitely we can think of establishing a subspecialty clinic or subspecialty this thing in our setup, because if you are not updated, you are outdated. So now, though we are backing on the old the history, clinical examination, systemic examination, which is still on today holds very good, up to 90% of the diseases you can diagnose. We have to take the help of the technology to diagnose, and there are so many advancements in the treatment of the diseases which are quite old and which are now new diseases are coming. So we have to update ourselves, and there is an opportunity. Definitely we should make it, sir. That's my opinion.
Absolutely. If you are not updated, you are outdated. It's a wonderful sentence to start today's discussion with. Dr. Agarwal sir, also thank you so much for sharing your experience. So now let's go ahead and...
Samir bhai, can I add one point? Is it
Yeah,
okay?
sure.
Now, yesterday years there was only general medicine. Then came the subspecialties, cardiology, nephrology. So when they started, now we are in a budding stage, what we think of. So what at this stage, if everybody are thinking that why should we as a, again, they'll come back to general practice of over and years because there'll be saturation of super specialists. So at this stage, we are in an what you call infantile stage. So I hope everybody has to do something or the other. As Dr. Obulreddy sir said, if you are not updated, you're outdated. So you have to do something of subspecialty. This is what I personally think, because general medicine has evolved in the same way pediatrician is also evolving into subspecialties.
So Pawan, that's a very important point, that it's not just that the specialist or the super specialist is evolving, even the pediatrician who's doing all of pediatrics is evolving. You're absolutely right. In fact, that was my next question. So with this desire that all of us want to get updated, how does a common pediatrician practicing in a standalone clinic or a pediatrician who's attached to a medical college or working in a corporate hospital, how can you incorporate all this? Would you continue as a generalist, or would you want to establish your subspecialty in addition to that? Dr. Khurshid bhai, we'll come to you. And after that, maybe Pawan, you want to touch up what you said. Dr. Khurshid Ahmed, sir, from Srinagar.
Good evening, sir.
Good evening, sir.
I thank the West Bengal Academy of Pediatrics for just giving me a chance. Sir, I quote my mentor, Dr. Sushil Razdan. He's a renowned neurologist of our North India. He once advised me that once I did my DM neurology, I was very jittery about leaving this stethoscope. I was very much jittery. I did not know what will be my future. But today he is the most renowned neurologist of North India, leaving the stetho aside. So we have to be we have to basically, sir, as the problems grow, we have to grow the subspecialties. Now there are different aspects. One is in the these metros, and then in the peripheries. Basically, possibly peripheries may have some issues, but otherwise, sir, we have to develop the subspecialty culture. But it depends. Yes, there are many issues. It depends on the interest, passion, commitment. It depends on the security, financial security also. There should be So there should be a this government policies, because I did my this developmental neurology in the first batch from Kerala. But there are government policies. I had to, for the neurology, I got all the equipments from Dr. Irasha, because government, so there has to be the equipments, the policies also from the government also, and financial security. Otherwise, I think we have to go for by the subspecialty. And I again quote, there is Dr. Radhakrishnan from Central. This was the this now president, vice president last year. They have a group of pediatricians who are doing under one roof. I think that's a that this stage we can do like that. They are doing multiple specialties in one roof. We have to be a little confident and leave this insecurity about our practice, that if we leave the general practice, then we will have no practice. I think that confidence and insecurity, we have to that insecurity should not be there. Maybe it may take some time, but we have to definitely the subspecialty. Now there is again one, I was going through a paper in US. There is then a problem in the different subspecialties. They have now people are going for neonatology and other, but again rheumatology, child this sexual abuse, child neglect, they are not getting people from there. Though that's again one more issue. I think government policies and financial security should be there, and we have to go through these subspecialties.
Absolutely. I think you brought about very good points. It's not just into quote unquote glamorous subspecialties like neurology or like gastroenterology. It's also about community pediatrics that Dr. Agarwal mentioned about some time back. Child abuse, child safety, child neglect. So again, Dr. Pawan, you want to add anything to what you said? How do you as a pediatrician, Pawan, also do your, because I know you do a lot of super specialty as well. So how do you balance both?
So the things are, we have to take it in two things. When you work in a periphery, you are the master of all, jack of none. Where if I'm not trained, Bakulbai in 2020 has invented DIP. In the same way, he also started the subspecialty clinics. So we should be very thankful, because most of the people don't know, but there was a facility which was created where the super specialists would be connected to these center of the peripheral areas where they don't have an access to the subspecialist. So we need to take the help of it, and we should be fair enough. Yes, I am having a little knowledge, less knowledge on this. We will take the help of, and it will be connected in the same room. The patient would be with us, the subspecialist would be with us, and the pediatrician. So they will have that confidence, and things go very smoothly. When you come to a medical college and a corporate hospital, if you don't have a special training and you have specialized interest in pulmonology or a neurology, and you start looking into the whole setup of faculty should also support your colleague that he has. So any neurology case has to go to this. Now the problem here lies here. There we have some amount of EGO which hurts us. So they will not be. This is a Pandora box, I do agree. And if I did an observership and I'm doing it, no, they won't, until unless you do a subspecialty or somewhere trained. So we need to encourage our colleagues, as well as if the junior is done and is doing something, the senior should also encourage. This has been happening. They are encouraging, but more appreciation should be done so that the subspecialty will develop, not only for him, but also it will be benefited to the college as well as his colleagues. These are my take-home points.
Thank you so much. So
Samir, can I come in here?
Yeah, Autorunda.
See, whether it's a corporate hospital OPD as Pawan referred to, or in a standalone clinic as Dr. Ashwini was saying, we almost have a supermarket-like situation. There are many supermarkets or shopping malls. Which mall or market the person prefers going depends on something special that he thinks that is there in that market. So when many doctors are available, initially when I started, we started, all of us, we do the general pediatrics. Some of us did vaccination. Not all pediatricians used to do. Then a time came when almost 98% of pediatricians, they now go for do the vaccination clinics. And now time is coming when probably we'll need a vaccinology certificate somewhere in the clinic, and probably that will initiate, or that will interest the parents to come for vaccination to that clinic. The same thing that we are having with the nurturing care and ECD certificates. We plan to promote that so that that's a special something that will attract patients to come and will be giving us normal pediatric help and also a specialized one that we can also offer to that parents. I think that is very important, and that is a pressure of that will come to the pediatricians. It's already coming and it will come in the future also.
I absolutely agree with you, Dr. Atanuda, and that's what I mean. What Pawan referred to also is very important, because you may be interested in the super specialty, you are in a peripheral area, you may not have super specialty knowledge, but you want a consultation and you want the patient to be with you, because otherwise the patient is lost to follow. So what he mentioned was about digital IIP, which Dr. Mukul Parikh had started at that time, something called smart clinics, where IIP would give you a connection to various specialties in all different domains. And you have a choice of connecting to one of them. And in your clinic, online, you can connect to that person. You are sitting there, the patient is in front of you, and you are talking to a consultant from, say, some other part of India or anywhere else in the world. So again, coming back now, this is one of the options, but looking at what our younger colleagues would want to do. So if we go ahead now, the question would be, with all this confusion, somebody who has just passed MD or DCH, will just come out in practice, he knows that she knows there's a lot of competition around, especially in a larger city or town. Should that pediatrician worry about general pediatric practice in terms of competition and compulsorily do a fellowship or a diploma to become a super specialist? Or should they still try and do general pediatrics as well as develop an interest in a subspecialty? We have with us Dr. Mondira. Dr. Mondira, what do you think? Because you are representing this generation here.
Right. So thank you. First of all, thank you to WVAP and all my respected teachers and seniors for having me here. Because all are my seniors, like very, very seniors. But what I would like to make some points here, sir. Already the part of metro cities and periphery is being discussed. Now, I am a person who has I have worked in Kolkata. I am working in Durgapur, Asansol, which is a tier 1, tier 2, tier 3, and I also work in periphery. So I would like to make a point here that first of all, when somebody is passing out of their MD, DNB, DCH, the area of practice is very important, like where they want to practice in future. So that will be the first thing they should consider in the long term. Then secondly, demand and supply factor. Like suppose I'm interested in autism or neurodevelopment, but the area I'm practicing has no zero awareness about it. So if time permits, maybe I can give a very funny incident that happened with me later. So this is one thing that after doing, if they go for a subspecialty, then they have to also see whether they can apply that to the that knowledge and skill to the place where they are practicing. Now, many subspecialties, they require a perfect setup. They require some particular setup. Like Dr. Mihir Sarkar was asking about critical care. So after doing a critical care, I cannot do practice in panchayat area. So I have to be in a metro city. So place of practice gives immense importance here. Now, sir, second thing is that general pediatrics is the soul of our practice. We cannot avoid that. No way, because even if you are like a super specialist or like a subspecialty practitioner, you cannot forget or avoid general pediatrics. That will come every day. Nutrition, vaccination, everything will come to you. You cannot avoid it. So you have to keep that in mind. So if somebody who is doing MD and DNB and straight away going to a subspecialty, so they may have this thing that they may develop a tunnel vision regarding that particular stream and forget all about the other specialties. So how after certain time, if they feel bored or they feel disinterested in their subject, or maybe they want a change, it will be very difficult to come back. So that is one thing that I feel. Now, sir, so exclusive subspecialty practice is very difficult in peripheral space, and exclusively general pediatrics practice is very difficult nowadays in a city.
Well said.
So these two have to be balanced. And sir, exclusive general practice is not a lucrative option for our generation people right now, because the scope of doing a super specialty has increased a lot in last decade. Because when even I joined DNB, I was like, everybody told, okay, pediatrics is an end branch. But now we are discussing, now that has become a general pediatrics. So this is what change that have been there for last 8-9 years, and also many subspecialties trainings are available right now in India. So people are mostly new generation people. They are during their residency period, maybe they are seeing that whether they are inclined to particular specialty, and they are straight away. Some people are straight away going to super specialty subjects.
I
So
think
this is the current trend. And another thing is that, sir, this choice of subspecialty is changing over time, taking into consideration all the medical legals and the brutality that is happening to the doctors in a like larger picture. People are now, they are preferring some cooler subspecialties. So not doing intensive care, but maybe neurodevelopment or endocrinology. So that will give them a good rest, or maybe a peaceful time. So, and also financial part is already told by other faculty, so I'm not going into that.
No, I think that's very
So
nice,
these are
Dr.
points.
Mandira. I think you've brought up some very good points. And what everybody has said in this first round of questions is that it all depends on where do you want to practice eventually. So the bread and butter still matters. If you're in a periphery, she said very nicely, Dr. Mandira, it's very difficult to be an exclusive specialist, super specialist. And if you're in a big town, it's very difficult to be an exclusive general pediatrician. So there is a mix and match of both, and we'll have to try and see how we go ahead and navigate this.
And I would like to just say a funny incident that happened with me. I practice in a very one clinic is there, which is in a very remote place. I mean, in a very peripheral place. So what happened? Like a few of my colleagues around that area, they referred a few autism case to me, and I was doing the both. Like I was seeing the autism and then maybe one cough and cold. So, like one patient of mine who visits me for general practice, someday she was like very innocently, she asked me whether you are a doctor of a normal child or an abnormal child. So she had that confusion in mind. So that's a very that's what the question that started me from inside. That okay, what should be the answer? So whether I
No,
can practice
you're
both
lucky,
skills or
Mandira. My patients ask me whether I am normal or abnormal. So you're lucky they asked you.
maybe
Sir,
sir, maybe sir.
one comment, sir, if you allow.
Yes, please, sir.
Sir, we should never avoid general pediatrics. We should encourage all the new pediatricians to be thorough with general pediatrics and sensitize them to take up specialty pediatrics at least in 1 or 2. They should have a vision. Now the peripheries are the district headquarters. Most of the pediatrics practice is by the general practice, MBBS, quacks, RMPs, other things. To be a now pediatrician, some specialist, and to deal with something, you should have some good skills. So if they are not in a hurry, if they have to fetch some time, another year or 2, it is worthwhile spending time on learning the other things and then coming to the practice. Because I am seeing so many new pediatricians who have come and started practice. They are struggling now. After a while, they are getting into the government job. They are working in PSCs. They are taking time, and again they are going for fellowship. Again they are coming back, unless they have a established center by their parents or there by this thing. If it is a corporate, it's fine. Otherwise, these are the practical. These are the ground reality difficulties we are seeing at the district level, sir.
No, absolutely right. Dr. Reddy, you are right. And that's why now we are going to go ahead to what do practically. Is there a scope for practicing both simultaneously? Can you practice general pediatrics as well as a specialty? So I'm going to ask Dr. Khurshid to tell us about that, and then we'll come to Dr. Pawan. Dr. Khurshid, we know you are a very good generalist as well as you are a very good pediatric neurologist. Do you practice both because you are in a government as well as a private setup?
Yes, sir. I am practicing. Yes, practicing both simultaneously allows a broader scope of practice and holistic care. But I know, sir, there will be a time when parents will be asking for a super specialty only. They will demand themselves. Now parents demand whether you are a pediatric cardiologist, nephrologist. It's a demand from the parents only. You see now the MBBS curriculum, they have they have just kept 2 weeks electives. They have just in the curriculum. So they are given a super specialty concept now in the MBBS only. Possibly in the future, we will have to opt for only subspecialties. But presently, yes, we can give, though a general pediatrician can never be, an internist role can never be neglected. That is there always, that will remain always there.
So the
But
role of
the
general will be neglected. True.
demand will be now of the super specialists by the parents themselves only.
Absolutely. Dr. Pawan, how do you manage this? Do you do both general pediatrics as well as your super specialty?
So very quickly, sir. At this stage, I would, before I closed my practice and went for my fellowship. So before that, I met Amdekar, sir. I was being a hardcore fan of Amdekar, sir. Sir, when before I joining, he said, first you should be a generalist, then only you can think of super specialist. So you should have the generalist scope. But if you, as Dr. Mandira said, if you are working in a metro and you said, I will do both, can't do those days, because the practitioner will not refer to you. In a periphery, yes, if you are staying somewhere else, differently, you can practice both. But the scope of this, when you ask this question, I would definitely say in a metropolitan or there, you cannot do a general practice as well as your subspecialty practice. But in a periphery, yes, I would definitely do both. And sometimes when I have a problem with neurodevelopmental, I would have given your number to one of my patients. I'm not an expert in that. Take the help of this person who done online consultation. So these are the things which every practitioner should develop. And what you call,
tell us what you do. Pawan, tell us what you do.
I do in a periphery, I do both, but in a metropolitan, I do only super specialty. That's it. If you want to do both, you have to choose a different area.
You see, sir, now in the every district hospital we have in adult DM people. So within a decade, in the pediatrics also there will be subspecialties in the district sense of these sub-district hospitals.
Absolutely. So now the other point is, for example, we already have a well-established pediatric practice. You can't leave it and go and do a fellowship. Would you like to collaborate with subspecialists and invite them over to your own clinic, either physically or via online? And would you want to provide the same care in your own clinic? Are there any benefits, disadvantages of the same? Dr. Reddy, what would you like to say?
Sir, definitely collaborating with the subspecialists is really helpful. I say yes to this because as a general pediatrician, I have to accept my limitations. We have to accept our facilities. All cannot be treated and managed by a primary pediatrician. And we should never think the specialists as our competitors. We should not talk any ill of their their fees or their expertise. Definitely, it will add extra care and extra result for the patient, and it will definitely add value to your clinic or your practice also, sir. Definitely, it is very much helpful. Here in our setup, in our district headquarters, there are no pediatrics, so many specialists in under one roof, or there is no corporate hospital. We have most of them adults super specialists, but doing some pediatric work. So we do take the help of all those people. Most of the times we are able to try to solve all the problems regarding the cardiology or endocrinology or gastroenterology, other things, nephrology. Only when it is really needed by extremely pediatric super specialist, then only we'll refer, sir. Definitely it will add value, sir.
Thank you so much, sir. Dr. Ashwini Agarwal ji, what do you think will be, how will you learn, how will you benefit by inviting somebody in your own clinic, either physically or online?
I totally agree with Dr. Reddy's opinion about the referring or incorporating in my own clinic. Even the concept of a smart clinic is also very good to have a online consultancy with the specialist. But it depends on the where you are practicing and what are the area where practice is there and what are facility available in the nearby. That's depend on that some of our colleague also have a practice like a general practitioner at the morning time, and in even Sunday he become a developmental pediatrician or a like that. They have started adolescent clinic for that.
Correct.
As per their interest and their knowledge. This can be also done in the same clinic with some allotted time or days for the particular subspecialty practice.
No, you are absolutely right, sir. I am aware of many of our friends who are doing general pediatrics, but they have a deep interest in adolescents, and especially they have worked with Dr. M.K. Nair, maybe, or Dr. Bhave ma'am, and Tuteja sir has been running a very wonderful website for the same. And there are many who keep a few hours in the afternoon separate only for adolescents, seeing patients with adolescence issues or with allergy or with developmental pediatrics. So that's fine. And then the final answer, moving on to technology, is you may not even need a physical or a human super specialist, because probably Chat GPT is going to be the ultra super specialist. So Dr. Pawan, quickly from you, do you use Chat GPT, Pawan?
I don't use, and Chat GPT is also done by human. So no human intelligence can be overtaken by any artificial intelligence. So one line answer, human intelligence is the topmost. That's it.
Dr. Khurshid?
Sir, I am not using it. It cannot be replaced. It cannot replace human intelligence. But yes, in counseling and some aspects, we may use it. But for the diagnostic and therapeutic purposes, I think human intelligence cannot be replaced.
So absolutely, I agree with you. So rather than looking at technology for chat, it's very important you should chat with your patient. And that is possible if in chat you add GPT, that is giving patient time. So Chat GPT should be chat by giving the patient your time for answering their questions. I think that will solve a lot of issues. So
Sir, one comment, such technology
may I
might help to narrow down our problems, narrow down the diagnosis, or it may help or aid in the diagnosis, but it may not zero down the problems. Human intelligence is always the final word, final answer to give the treatment.
Absolutely. Yes, somebody
Sir,
else?
may I say something?
Yeah, Dr.
Yeah.
Mahindra is coming.
So, sir, we cannot avoid ChatGPT. We have to use this in next few years, maybe in next coming years, but not replacing us. Obviously, we cannot compete with robots. So it's a good idea that we can increase our knowledge and also many other evidences that we can get from that, but not replacing in terms of treatment or something like that.
Superb.
Nothing beats physically seeing the patient, sir.
Absolutely. I completely agree with you. Chatting with the patient is the most important thing. So going ahead now, coming to a very specific issue, and I'm happy we have Ashwini Bhai here today because he's so good at all these constitutional and legal issues. Bhai, how does one look at this? Do you charge differently for general pediatrics related work and super specialty related works? Like you said, there are some people on a Sunday, they may do only adolescents or a developmental practice. And on the other days, they may do general practice. So are you allowed to charge extra? Is there a medical legal issue? कैसे देखें इसे?
नहीं सर, इसमें ये जहाँ पे लॉज कुछ नहीं बोलता है वो तो एम्बिग्यूइटी है. You can charge same or as far as how much time you spend for the patient. So cannot we have a same fees or same consultancy for the general practice or a adolescent pediatrician or a practicing as a developmental pediatrician to have a given more time and more knowledge or more skill to the patient. So it may depend, and charge you can has as per your area and your time and your time given to that. There is no straightforward or strict restriction as per the bylaws की आप इतना ले सकते हैं, इससे ज्यादा ले सकते हैं. ये आपके ऊपर है, आप कितना लेना चाहें. सामने वाला देने को तैयार है तो आप लीजिए.
Absolutely. Yeah. You should give value for what you are charging. And people say that always the patient should always find more value that you are giving rather than the amount that the patient is paying. So that's, sir, thank you. As usual, itna clearly aapne bataya. So again, I'll move on to Dr. Reddy, sir, now. What if a good pediatrician is also interested in 2 or more subspecialties in practice? And I'll combine that with the next question. How many chapters does the IAPN should be, need to be a member of and followed diligently? Last GBM, we decided that there cannot be a restriction because somebody may be interested in 5 specialties or 5 chapters. But basically, how do you look at it? Because I'll ask both of you, Dr. Reddy first. Are you a member of subspecialty chapters? Which chapters are you a member of and how do you keep it?
Sir, given the era now, each system has the specialty chapter. So it is difficult to master all the specialties. You cannot be you may be jack of all trades, other trades, but not medicine in so many things. It is not possible, humanly impossible. So instead, whatever you have the passion, you choose 1 or 2 and you become expertise in that. And you can really justify in doing those things.
Absolutely. Absolutely. So I want to take a very direct answer from Dr. Ashwini, sir. Aapko kya lagta hai, how many chapters can you do justice to? Can you really attend the meetings of the chapters? Are you able to get the information? Does it benefit you as an IAPN? IAP तो allow करती है, मगर आपको क्या benefit मिलता है?
As for personally thinking that कि मेरे को लगता है कि 3-4 चैप्टर जिसमें अपने को ज्यादा इंटरेस्ट है और जो अपन कर सकते हैं, that will be sufficient. Not to we have a member of all the chapter sub specialty chapter and IAP. जैसे मुझे मैं कम्युनिटी पीडियाट्रिक्स में भी हूँ, न्यूरोलॉजी में भी हूँ. अब रेस्पिरेटरी और इन्फेक्शियस डिजीज के तो सभी हैं जनरल प्रैक्टिशनर. So that depend on the personal choice, but not to be more than 3 or 4 sub-specialty chapter membership in as IAP forum, for the IAP forum.
बिल्कुल बिल्कुल. Also, one specialty we haven't talked about is intensive care because that's such an important part. Many pediatricians already have a ICU, a small ICU or an NICU in their own clinic. So that is another specialty that many people do together. Pawan bhai, what do you say, yaar? What do you think?
It's very difficult to attend all of the meetings. So in respiratory, you have added environmental, 1 subspecialty, then allergy, 1 subspecialty. All can go hand in hand. IAP has to think in this manner because you are the mastermind. Very difficult. And neurodevelopment and the neurology can go. It's very difficult. You might have passion, but they go together simultaneously. And you cannot attend. So for sake of updation, you keep on adding, but you'll join the what you call the group, but you will not be updated because you don't have time to go through each and every things. And nowadays you have become member of WhatsApp group, same would be running through all. So there is no time. Read all, everything gone. Anything important also goes away.
I am told that you should become member of different chapters so you have different friends. So
definitely becoming sir, excuse me, sir. Becoming a member is not an issue. It is better to become the member of all the chapters, which hardly cost 1,000 rupees for each chapter. It will definitely enlighten you and it will enrich your knowledge. But application in all the fields, it may be difficult.
Absolutely. So finally, we'll come to the last question of the day to our panelists. And again, I'll ask Ashwini bhai to answer this. Are there any medico-legal rules and regulations about doing both general pediatrics as well as a subspecialty? And how will the pediatrician also practicing a subspecialty be judged in court as a pediatrician or as a super specialist? Suppose I am seeing somebody seeing a child for a condition which otherwise would require a subspecialist who has a fellowship. But this person says, "Bhai, I am already a member of the chapter. I am good in this subject, and I could have dealt with this." फिर क्या होगा? How do you deal with it?
Sir, वो depend करता है कि whether the some special rules are there for that sub-specialty or like a cardiology practice or like a nephrology practice or something. If there is a radiology, PNDT Act is there. In that you have to have some specific certification, authentic certification. Otherwise, as a MBBS, you can practice as a pediatrician also, as a geriatrician also, and as a ऑप्थेल्मोलॉजिस्ट है, सम कंजक्टिवाइटिस का ट्रीट कर सकते हो आप, लेकिन अगर आप बोलोगे कि मैं कैटरेक्ट का ऑपरेशन कर दूंगा तो वो मुश्किल है. तो दैट when they some special rules are there, then you have to follow that. Otherwise you are free to have but you have a scientific data and your practice has some scientific uh, support to on the court of law, then only you can go for the practice on that.
Absolutely. As long as you can justify what you did, you are competent enough to do, and it was in the best interest of the patient, and you have not overcharged or done any malpractice, I think you should be fine. Thank you so much, sir. So well said. I think we have come to quite the end of a few questions which I had kept for today's discussion. Now we are happy to go for the audience round. Meanwhile, we have some wonderful experts. Swapanda is there with us. Autonuda is there. Kalpana Di was there. Anybody else who would like to add any points? Time is open for the other members of the panel to speak, and then let us know what is to be any questions that you have. So please give us your comments. And this is a question that has been put up by one of our delegates, of our participants today, and she said a very interesting point to note, that my interest in particular super specialty changes every 8 to 10 months. I think you are a true pediatrician, because that is very important. That means I have really studied pediatrics, and each and every subspecialty or sub branch of pediatrics is equally important to you. So hats off to you. That's the first comment I'd like to make. And I have done diploma in allergy, asthma, immunology. Now I want to get more experience in development pediatrics and neonatology, but I'm confused which subspecialty to focus. So please guide. Bataiye. And please, everybody, or not just the panelists, everybody else on the screen is more than welcome to answer. Dr. Das, I see you have raised your hand, sir. Dr. Samir Ranjan Das, please unmute yourself.
No, actually, I raised my hand to say something, not to answer this question. Okay.
Let's have somebody talk about this question. And
so
then
actually, Somir bhai, when I listen to you, I become interested in neurodevelopmental pediatrics. When I listen to Pavan, I become fascinated with the pediatric pulmonology. When Kalpana ma'am says, I am also interested in neurology. So what Dr. Jamie has said actually support this. So in fact, I want to know each and everything of it. But the problem is that, say, the child has come as a general practitioner, and I think that the child might be suffering from autistic spectrum disorder. So now I have to come with the M-chair, and should we impose any extra fees for that? Actually, we can't. So what is the use of doing? Either you go for doing the specialist practice like what you are doing, leaving aside your general pediatric practice, or you do general pediatric practice with augmented knowledge so that you can cater the population in a better way. This is for you only, for your inner satisfaction. So I belong to the second category. I want to know a little bit of more, so to cater the population better, in a better way. So this is my take.
Absolutely. Any other comments? Absolutely right, Sopan, because this shows that you are basically a very good pediatrician, because you are interested in all the subspecialties. And some like us are not good at pediatrics, so we chose one line and keep harping only about that.
So I
think it's a human tendency.
Not that I'm happy.
But you have to ultimately choose one subspecialty to excel. It's not that possible that every subspecialty. You have to keep one subspecialty. It's a human tendency.
Yeah, I am doing radiology, because I am trained in Institute of Child Health as a pediatric radiology. So my fascination is pediatric radiology.
Sir, may I say something about this?
Mandira, sure.
Hello.
Yes,
Sir, I think this question has two aspects. Like, I love some subjects and I want to do a career out of it. So this is like, I am a doctor, but I also like music. So now I want to become a stand-up like YouTuber or something like that. So it does not mean that you cannot study something. You can study, you can do like a diploma in allergy, nephrology, in whatever area. But that does not mean that like you have to be restricted to one thing. For your knowledge purpose, you can do. Like if you like something, you can do. Go ahead with that. And maybe after a few years, when you exhaust all the options, then you come back to one particular thing and take away with that. Like continue for the long time. I think sir, this sir told very sincerely that very well that this is a human tendency. So it will settle after a certain time.
That is so smart because we have so many gods, and no god says don't go to another person. You can go to everybody, everywhere, and
Right.
India is a land of
Yes.
knowledge. India is a land of variety, diversity. We can learn. The more we learn, the better we become. There are no two things about it. So I agree with you. Dr. Das, you wanted to say something.
Sir, can I add one point before?
I say something?
Dr. Das, Pawan, I'll come back.
Yes. May I say something? Am I audible?
Yes,
Yeah,
Dr. Das.
Yes. Actually, what I want to say is that whether the health actually whether we'll build up the soft specialty, super specialty, everything will it depend on the demand of the country. Actually, we'll consider that also. We should not consider only our thing, but what is the population of India and what is the requirement of the pediatric population of India today. To me, is that it needs much more general pediatricians than subspecialties, because they are to serve to the interiors of the country to give the quality service. What I suggest that if we can think that what are the subspecialties in our curriculum, if we can train the pediatricians to most of the subspecialties in a short way, short course, we'll have to think of this, that whether we can train them so that they can act as pediatrician, and also the topic we are discussing here, that whether he can develop some subspecialty in his practice in the as a general practitioner, because that is important. Because if we all become some super specialty or subspecialty, then one day someone has to refer a child to someone to say that whether this is a child or not, because everyone is a specialist. So general pediatricians will not be there. Everybody will have the tendency to be a subspecialty, to empanel him as a subspecialist. So I would request the panelists and the audience to think over it, that whether in the curriculum, in the curriculum of the pediatrics, IAP can think that subspecialty chapters can be included in a very small way, in a nutshell, so that they can develop their subspecialty practice in their general practice. Thank you.
Thank you so much. Yes, somebody wanted to come. Pawan, you wanted to come in.
Yeah. Sir, I would first answer to sir. So you should basically define what is subspecialty. For me, if I ask an pulmonology in Australia, asthma would be done by general pediatrics as well as pulmonology, but all asthmatics would not come to a pulmonologist. A patient who has been admitted to PICU with an asthma, or a child who has born preterm, who has been on a ventilator, those are certain criteria which would be referred. So we are not asking every person to become a subspecialist. They should have a generalist practice with an idea that once you are needed to develop, because only 10% require subspecialties. Not every child would require a what we call subspecialty. The second point which I wanted to say is the developmental pediatrician, sir. The way you analyze is entirely different from the rest of the pediatricians. So you come back to, as Dr. Mandira analyzed that in this question as the 2 points, as Samir Bhai also, the chat GPT has chatting with the giving patient time is entirely different. So that is the reason people get attracted to do more of developmental pediatrics. It is not because of what you call it is a cool branch or something else, but it is the way we approach, the way we take time to talk with what you call, as a pulmonologist, what I see, whether there are V's or not, okay, because the time you spend with the pediatric, what you call the child is more, that's what I feel. So sir, we are very much lucky to have you, and you make the things much more easy for everybody of us.
Thank you. Anybody else? Any other comments, please? Arubda,
Dr.
say something
Samir,
words of wisdom. Arubda, Arubda, some words of wisdom from you.
Samir, basically, we have the thorough knowledge of the theoretical and clinical aspect of the general pediatrics, where we can pick up the general disease and also the special disease or the disease which has to be, you have to diagnose first. Then if it is in your capacity, you do the treat. If not, then you send to the specialist persons from the locality where we do practice in our block or subdivision hospital or district hospital. This is not same as the metros, which Mandira has already said, but Pavan has already said. So you must have the thorough knowledge in the general pediatrics, where you can diagnose the particular disease the child is suffering from. This is the most important. Basically, you should be a very good general pediatrician from where you can pick up the disease.
Absolutely, absolutely, absolutely. There's one more last question from Dr. Ghosh. The awareness of subspecialty is needed very much as a screening tool in a large populated country like ours. That's a wonderful point. Wonderful. That we don't need it in detail. You don't need to be having a diagnostic tool, but screening tool ka utna knowledge to hona chahiye. Any comments? I think that's a very beautiful comment, Dr. Ghosh.
Yes, yes.
I think we all agree with it. And I think we have come to the end of our very interesting discussion today. And with thanks to all of you, I think I'd just like to, before I hand it over to the chairpersons, I would just like to say that the sense one got from this discussion was, bhai, super specialty is very tempting, very interesting, very necessary also, but it cannot replace general pediatrics, because the beauty is in all of it. All the aspects of general pediatrics, what we call subspecialty or super specialty, all of them are interesting. And hence, I like to end by saying, Mirza Ghalib in this, you said, Hazaro khwahish hai aisi ki har khwahish pe dam nikle. You want to do pediatric nephrology also, pediatric urology, cardiology also, developmental pediatrics also. You want to do bit of neurology also. Hazaro khwahish hai aisi ki har khwahish pe dam nikle. बहुत निकले मेरे अरमा लेकिन फिर भी कम निकले. That you still want to keep learning all the subjects. And with this, I'd like to end today's session and hand it over to our dear chairpersons. Thanks a lot for you.
Samir bhai, there is always chance place of the all-rounder.
Absolutely.
Batsman, bowler, fielder, तो सभी होते हैं. एक आध दो प्लेस तो रहता ही है ऑलराउंडर के लिए.
2020 में तो सिर्फ ऑलराउंडर ही चाहिए.
Thank you.
Thank you, Samir sir, and all the panelists. Really, it was a very nice and fruitful discussion. Sir, हमें जरूरत है आजकल जो मेडिकल साइंस विद एडवांसमेंट इन मेडिकल साइंस, हम सब चीज नहीं कर सकते हैं, लेकिन बहुत कुछ कर सकते हैं. इसी की बात है, हमें चूज करना है कि हम किस स्पेसिफिक में अपने कंफर्टेबल महसूस करते हैं. जनरल प्रैक्टिस हम हमारे हमेशा, इट शुड बी विथ आवर साइड जनरल प्रैक्टिस, but we can offer some help in some, like say take the subject of nephrology. You can do peritoneal dialysis in your clinic, but if you want to start peritoneal dialysis, even pulmonology, even gastroenterology, so everything is not possible. You have to select one field where you feel yourself comfortable, and if you provide some extra care to our patients, it will be fruitful for the society also. So I think you will be a better speaker than me. Why the IAP has started the fellowship in various subjects. I think this should be one aim, that we fellow pediatricians should know something about the subspecialty chapter, because pediatric patients are not the suppressed adult. Their needs, their physiology, all things are different, and so we should make ourselves aware how to serve the community in a better way, our many patients. So thanks to all of you. Thanks very much. It was really very nice and fruitful discussion. Thank you from my side.
So I
Thank you.
request Atanu to give his parting comments and wind up the session.
Oh, thank you to all the panelists, Dr. Pavan, Dr. Ashwini Agrawal, Dr. Wani sir, Dr. Bula Reddy sir, and of course, our very own Dr. Samir. So it has, I think the discussion was one of a kind, and it has started our train of thought going. And probably in one of the pedicons, we will have a debate on this. And definitely a take-home message is that we will develop the sub-chapters, and we should encourage all our young IAPians to be part of some of the sub-chapters to find out which one is of interest to that. And let's say good night. And again, thanks on behalf of WAP. We'll have the discussion in the YouTube. So anyone who, those who missed it can have a look at in the YouTube also. I'll post the YouTube link after the session is over. Thank you.
Thank you.
Okay, thank you,
Good night,
everybody.
sir.
Thank you,
Good
thank
night.
you, and
Good
good
night,
night.
everybody.
Good night.
Thank you, sir.